Hello, good morning all of you. Today I am going to teach inflammation and healing. So now we'll start with the inflammation. So we'll start with the definition of the inflammation. So inflammation is defined as a local response of living mammalian tissue to injury. It's a local response of living mammalian tissue to injury due to any agent. Okay, so first we'll discuss about the type of inflammation. There is a two type of the inflammation. One is acute, another one is a chronic inflammation. In the acute inflammation, it's long last for the less than 2 weeks. Okay, and in the chronic inflammation, it's longer duration, either after the causative agent of the acute inflammation persists for long time. It's a longer durations, more than 2 weeks. So now we'll discuss the feature of acute inflammation. So first of all, there are so many features of the acute inflammation. First of all, accumulation of fluid and plasma at the affected site. Accumulation of fluid and plasma on the affected site. Second one is the intravascular activation of platelets. There is a activation of platelets. Activation of platelets. Third one is the neutrophils present as the inflammatory cells. Okay. Now the feature of the chronic inflammation is that there is a presence of chronic inflammatory cells. Chronic inflammatory cells such as lymphocytes, presence of lymphocytes, plasma cells, macrophages, and granulation tissue formation. So in the acute inflammation, we divide acute inflammation in the two event. There is a two event. We can divide the acute inflammation in the two event. First of all, the vascular event. Second one is the cellular event. In the vascular event, also we can divide. There is an alteration of the vessels, such as microvasculature, means arterioles, capillary vessels. So in the vascular event, there is a two alteration include. One is a hemodynamic changes, another one is a vascular permeability. Okay, now next, one by one we'll discuss the hemodynamic changes and the vascular changes. In the hemodynamic changes, first of all, in the hemodynamic changes, this is the earliest feature of inflammatory response. Results from change in the vascular flow. In this, the vascular flow is changed. Because of that occur hemodynamic changes. There is sequence of the changes. In this sequence, sequence. In this sequence, first of all, transient vasoconstriction of of arterioles. Second is persistent persistent progressive vasodilation. And third one, progressive vasodilation in turn may increase the local hydrostatic pressure. Progressive vasodilation. Now, fourth is slowing of microcirculation flow. Microcirculation. Fifth one, slowing of after the slowing there is a leukocyte marginations. Leukocytic margination. Now we'll discuss about the signs of inflammation. There are the 5 main cardiac signs of inflammation. So first of all, rubor, tumor, color, dollar, and functional lesion. In that, rubor means redness, and tumor means swelling, color means heat, and dollar means pain, and functionalism means loss of function in that particular area. Now this is we completed the hemodynamic changes. Now second one is alter vascular permeability. Okay, this one is the ultravascular permeability. The pathogenesis of the ultravascular permeability is that in around the inflammatory tissue, suppose inflammation occur in this area, around the inflammation tissue, there is a accumulation of edema fluid. What happened in this? First of all, the accumulation of edema fluid. Okay. And the appearance of the inflammatory edema is due to increased vascular permeability. Okay. Now the second things will start, that is a cellular event. There was a two things, one is a vascular event, another one the cellular event. So we'll start with the cellular event. In the cellular events, there is also two main things happen. First of all, the exudation of leukocytes. Exudation of leukocyte. Okay. Second one is phagocytosis. In the exudation of the leukocyte, The most important feature of the inflammatory response is that escape of the leukocytes from the microvasculature. Means the leukocytes come from the microvasculature to the interstitial tissue. And there is also changes leading to the migration of leukocytes, as I'll tell you the changes. First of all, the changes is change in the formed element of the blood. So we'll describe the changes. First of the inflammation occurred in that area in the early stage. Second one is the increased blood flow on that area. Third one is a slowing of blood stream. And final one is a change in normal axial flow. Changes in normal axial flow. No, after the changes in the formed element of blood, there is a second one is a rolling and adhesions. Rolling and adhesion. In the rolling and adhesions, there is a peripherally marginated and pigmented neutrophils slowing roll over the endothelial cells. Means the neutrophils come in contact with the endothelial cells. Okay. And third one is a immigrations. So now in this the neutrophils lodged between endothelium cells. Between endothelium cells and basement membrane. And final one is this chemotaxis. Now this is the exudation of the leukocyte. Second one will start with the phagocytosis. And the phagocytosis is defined as a process of engulfment of solid particle material by the cells. Is a engulfment of solid material. Engulfment of solid material by the cell. Okay. By the cell. And those cells who perform that function, that is also called phagocytosis. There is two main cells which perform the phagocytosis. One is the polymorphonuclear neutrophils. Another one is the macrophages. These two cells perform the phagocytosis in the three steps. One is the recognition and attachment. Second one is engulfment. And third one is a killing and degradations. Okay. This is the short review of the acute inflammation. Thank you so much.